here with Dr. Rinta to go over some commonly asked dental questions about dogs and cats. Our first question is, how many teeth does a dog have?
A dog has 42 permanent teeth.
Okay. And how many teeth does a cat have?
An adult cat typically would have 30 permanent teeth.
Okay. And at what age do all the adult teeth come in?
Typically, all the adult teeth are in by 6 months of age.
Okay. And I've heard that animals' mouths are actually cleaner than humans' mouths. Is that true?
That is not true. The same bacteria that infect humans' mouths will affect dog and cat's mouths. And humans, we're brushing and flossing twice a day, and most of our dogs are not. So they actually can have a very dirty mouth.
And how can I keep my dog or cat's teeth clean?
Brushing is probably the best way that you can keep your dog or cat's teeth clean. It can be a little bit challenging to teach your dog or cat to accept brushing. There are other things on the market too that are very helpful. There's a lot of really good oral rinses, and there are dental chew treats that are available, and different toys that are dental, where you can put toothpaste on them, and the dogs and cats will chew on those, and that can help. And there's even formulated diets that are made now that are very helpful to remove both plaque and tartar.
And how would I get started brushing my dog's teeth?
Well, it's kind of a process to get your dog or cat accustomed to brushing teeth. So you want to be really patient. Make sure you have the proper tools. So an appropriate sized toothbrush for the mouth of your pet. And then you also want to purchase dog or cat toothpaste. The paste that we use for humans is not made to be ingested, so that can actually upset their stomach. So never use the human toothpaste. Once you want to start, what I recommend is to desensitize your pet. You want to take your finger, around their gums and get them used to you just sort of massaging their teeth and their gums. Once they're accustomed to that, then you can gradually move up to maybe gauze on your finger with a little bit of warm water, and just massage the teeth and the gums. Once they're used to that, you can move up into the appropriate size toothbrush and then apply the toothpaste. Just be very gentle. You don't want to scrub hard when you're brushing their teeth. You want to just do small little circular motions, because sometimes we can damage the gum line even from brushing. Always praise your pet positively for every step when you're doing that process, and just be patient. Don't give up fast. And once you get them accustomed to it, what happens is sometimes we just forget to brush our dog's teeth. So I always recommend to put their toothbrush and toothpaste in a little cup in your bathroom, and at night when you're brushing your teeth, then you'll see theirs right there, and you can just get down on the floor and brush your dog's teeth at the same time.
Okay. What if I decide to do nothing?
Well, like with humans, if we do not do home dental care, we're going to end up with some serious gum disease with time, and that can lead to other problems. It can lead to tooth loss, periodontal disease, and the infections occasionally can go into the bloodstream and cause systemic illness. The bacteria can even go onto our heart valves, can go into our kidneys and cause urinary tract infections. So you will see some ramifications if you do nothing.
Okay. And can gum disease be reversed?
That's a really good question also. There are different stages of gum disease. So in the very early stages, where there's mild gingivitis, or very early gum disease, we can sometimes reverse that. In the later stages, we can't always do that. We stage it 1, 2, 3, and 4. Stages 1 and 2 usually include just some mild plaque, maybe some mild tartar, some mild gingivitis, and those are reversible stages. And so we tend to want to do professional dental treatments during those stages. Once the plaque turns to tartar and the tartar advances under the gum line, it can cause the gums to detach from the root of the tooth. And when that happens, sometimes we eventually end up with some bone loss too. So infection right down into the bone around those teeth. And those are the advanced stages, stages 3 and 4. And when those stages happen, very often we have to extract those teeth. So it's much better to do preventative care and to try to reverse things and keep the things at the stages 1 and 2 instead of waiting till the mouth is so horribly infected that we have to go in and do these professional treatments and then have to extract a lot of teeth.
Okay. So what would you recommend for people for doing home dental care? on their pets at home?
Yeah, that's a good question. You'll want to have an individual plan depending on your commitment level for your pet. So it would be ideal, I think, if you brushed, daily would be wonderful. Doing the oral rinses occasionally and having a good dental tartar diet to help remove tartar. And then consult your veterinarian about when it might be necessary to do a professional dental treatment, at the veterinary clinic. And your veterinarian probably has their own special things that they like to help keep the mouths clean.
Okay. Thank you, Dr. Rinta. That ends our questions today on dental questions.